So I'm going to tell it to you again in just very top contour terms. Somebody takes a pill or an injection or sublingual ketamine. It makes its way into the bloodstream, and then it makes its way into the brain. Once it's in the brain, it binds to a particular category of receptors called the NMDA receptor. The NMDA receptor is a receptor that normally is quiescent. It's just kind of sitting there. It doesn't tend to do a lot under normal conditions of everyday life. However, the NMDA receptor's typical function, okay, so when there's no ketamine in the body or brain, is to detect abnormal levels of neural activity, and in doing so, recruit changes to cells, receptors, etc. Literally change the neurons in ways that allow them to respond to that activity in the future without having to be under such big metabolic demand. And they do that by recruiting more receptors, etc. Much in the same way as when you overload a muscle in the gym, it will eventually recover, if you allow it to recover, and it will get stronger through the addition of a bunch of new proteins. The nerve communication of that muscle will change. The muscle and the nerve to muscle connection change. It gets stronger, and sometimes it gets bigger and stronger. In the same way, a neuron can change the way it functions in response to experience. And neurons don't know experience of life in any other way except the patterns of electrical activity and chemical activity that impinges on them. Okay. Now, ketamine, the drug, binds to and blocks that NMDA receptor. So the obvious conclusion would be that ketamine prevents neuroplasticity, and that's not what happens. We know that ketamine actually induces neuroplasticity, and it does so specifically in the brain circuits that control mood. The net consequence being improvements in mood. How does that happen? It happens because ketamine binds to and blocks those NMDA receptors on inhibitory neurons. The inhibitory neurons are the neurons that normally suppress the activity of other neurons. So when ketamine binds to the NMDA receptor, the activity of those inhibitory neurons is reduced, and as a consequence, excitatory communication between neurons in those mood-related circuits increases. And it increases in a way that recruits neuroplasticity, that strengthens those connections and makes them more likely to be active in the future. Now, it is not the case, at least at clinical doses, that ketamine induces seizures. It certainly can at higher doses, but at clinical doses, when ketamine suppresses the activity of those inhibitory neurons and the excitatory neurons ramp up their activity, they're ramping up